A recent study found half of U.S. adults reported difficulty affording health care, and 1 in 4 said they skipped needed care because of it. Internist Dr. Alida Boru joins us to discuss the reason for increasing medical costs and what patients can do to protect themselves. Doctor, thank you so very much for joining us this morning. So why are we paying more at the doctor's office?
It's such a delight. Thank you. Well, very few people know that across the country, big hospital systems are buying up smaller doctors' practices and then are able, because of that, to charge more for the exact same care. The clinic has a hospital name on it. These hospital systems will raise prices for very routine care. For instance, getting a chest x-ray or an allergy test. And, as we know, studies show that prices can increase by more than 14% when that happens.
That's incredible. So what's the impact on patient outcomes?
Well, I know as a doctor that when this happens and prices go up, people may delay getting care. I saw this as a hospitalist. When the patients didn't get preventive care, they ended up in the hospital with advanced, untreatable metastatic cancers. This shouldn't happen. So, as you said, this is causing half of people to, think about not getting care. And also these billions of dollars of unnecessary expenses are driving up insurance costs for everyone without any actual healthcare benefit.
Okay, so let me ask you, doctor, what can we do to control rising costs?
Well, we have one solution, and that is that patients should be aware of these added fees due to this consolidation of our healthcare system and the buying up of clinics by hospitals. And so patients should all demand that and fight for legislative reforms to pay the same price for the same service regardless of where they get their care. So we have actually a website that the Committee to Protect Care has a website called samepricenow.org, where people can actually get more information and take some initiative. People should look at their hospital bills and see whether any of these added unnecessary fees are actually tacked on to their clinic bills, for instance, after they've gone to see their doctor.
Very interesting. With the rising costs, people are absolutely going to, avoid it because maybe they can't afford it. So, hey, doctor, before I let you go, give us the information one more time. Where do we go to learn more?
Okay, a website. The website is called samepricenow.org. Samepricenow.org. And thank you so much for having me on your show. Doctors want to make sure that patients get the care they need.
Absolutely. Thank you very much, doctor. I really do appreciate your time this morning. Best of luck to you. And guys, if you want to catch this segment again or others like it, just head over to First Coast News Plus.